Welcome to part 2 of this two-part series on exercise prescriptions in cancer care. In part 1, we learned that, like a medication prescription, exercise too can be prescribed in a dose with how much, how long, and how often. Exercise certainly doesn't need to be hard, but there are certainly barriers and questions for most people, and this can be complicated when you're a cancer survivor or in cancer treatment. So this begs the question, can people with cancer learn to progress and regress their own exercise prescription when they are pretty gosh darn sick? The answer is yes. I'm cancer rehab specialist Dr. Leslie Walke. Welcome to the Recovery Room. There are two things I teach my patients in cancer treatment to help them determine how long and how intense their exercise session should be. The first is, what is their immediate response to the exercise? And the second is, what is their delayed response to the exercise? Let's begin with the immediate response to the exercise. As people exercise, I will have them periodically ask themselves throughout the session, do you feel better? Do you feel the same? Or do you feel worse? If quite debilitated or fatigued, you could set a timer and ask yourself these questions every 3 to 5 minutes. If your answer is, I feel the same or better, you continue on with the exercise for another 3 to 5 minutes. And then ask yourself again, do I feel better, do I feel the same, or do I feel worse? If at any time you feel worse or more drained, you stop. You then take a 5-minute rest period and then resume, or do your second exercise period again later in the day. The second thing is to learn to assess your delayed response to the exercise. So how do you feel 4 to 6 hours after completing the exercise session? If you feel fine, have the same or less pain, the same or less fatigue, and sleep well, these are good responses confirming the exercise dose was appropriate. If, however, you feel increased exhaustion, fatigue, or pain and sleep for like 3 days in a row as a result of the exercise, even if it felt good at the time, it was most likely a bit too much. If you are currently in treatment, you will need to learn to progress and regress your prescription fairly often, as you will feel different from week to week. Eventually, you should be exercising about 30 minutes a day on most days of the week. For some people, that can take several weeks to build up to. That's okay. When beginning exercise, I don't care how fast you go, I don't care how far you go, just work on building up your minutes. If you can't yet do 20 minutes continuously, break your exercise periods into 2 to 3 chunks a day. Once you can do 20 minutes consecutively, you can then exercise once a day. You exercise? Yes, you can. Yes, you should. The quality and the length of your life depend on it. I'm Dr. Leslie Walke. Thank you for joining me in the Recovery Room. Have a great day. Let's talk again soon. All right, here we go. In part 1, we learned that, like medication, exercise We're going to try that again. In part 1, we learned that, like try that for a third time. Zen, relax, we're all good. Okay, here we go. Welcome to part 2 of this two-part series on exercise prescriptions in cancer care. In part 1, we learned that, like a oh my God, what is wrong with my lips?